Safety questions usually shows up under maternity and newborn. They are not going to use the word safety in the NCLEX when we come to maternity and newborn. We are just preventing injury to the mother and the newborn. 10 question, SATA question on how you can recognize maternity and newborn safety question. Let's get together and do this together. First question. Like I say, it's a safety question. So look at it, select or apply, stop the video, answer the question on your own, and keep track of your score as usual, right? What do we have? So a nurse is pregnant. Is reviewing client assignment for the shift. Which assignment should the nurse question? Select or apply. The nurse needs to protect herself. She should not take any assignment that will put the baby in jeopardy. She is pregnant. She's now the client. That's the way you think about it. She needs to protect herself. Environmental safety in this situation. A client with what? Parvovirus B19 infection. Should the nurse take care of this patient? The nurse is pregnant. Client with positive Mattos test. Should she do that? A postpartum client 2 days after C-section. A client receiving radioactive iodine therapy. A client with what? Cytomegalovirus infection. A client with pneumonia receiving antibiotic. Should the nurse who is pregnant take care of any of these patients? Stop the video, put down your answer, keep track of your record, and figure out your score at the end. What do you think? Like I said, if this is a safety question, we want to protect the nurse. We don't want to cause injury to the nurse. And therefore, based on the keyword, we are going to question who? Parvo B19 is a bad problem. This is infectious. It's one of the touch infection. When the baby get infection of this, is going to have congenital problem. The nurse should avoid. She should not take a patient who have Parvo B19. Mattos test is a PPD positive. She can take care of it. Postpartum client 2 days after C-section. It's okay. There is no contraindication to that. Client receiving radioactive iodine therapy is not good for pregnancy. Radiation. I got a question there. Client with what? Cytomegalovirus infection is another touch infection. We need to question. Pneumonia receiving antibiotic, we're good. If you don't know the touch infection, I'm going to write it there. TORCH, where this is toxoplasmosis, this is others, includes syphilis, Parvo B19, this is rubella, this is CMV, this is herpes. Check out that NCLEX infectious control. You will see a bunch of these infections that a pregnant nurse should avoid taking care of them or come in contact with. So these are our answers. Do you get it right? I know you did. A nurse is inserting an IV in a postpartum client and accidentally sustaining a needle stick injury. The client is HIV negative. I intentionally give you HIV negative. Most questions will say HIV positive. It's the same strategy. One difference I will show you. HIV negative. You stick yourself. It does not matter whether the patient is HIV or not. It's a needle stick. Accidental needle stick does not matter the status of the patient, except what the only difference is you may do additional thing if the patient is HIV positive. But the protocol is the same. Therefore, which action should the nurse take is appropriate. Wash the site immediately with soap and water. Report the incident to the supervisor. Begin post-exposure prophylaxis immediately. Complete an incident report. Squeeze a needle stick site to let it bleed. Follow facility exposure protocol. Screen the client for hepatitis C infection virus. As usual, pick your answer choice and let me know. You can put it in the comment or at the end, let me know your score. What do you think? I can tell you, the first thing you should do is the protocol. Always watch. Then what? Inform, report it before you document, and then you follow protocol. So we're going to wash this. Is there anything washing? Yes, I'm going to wash it. I'm going to talk to my supervisor. I don't need post-exposure prophylaxis. The patient is what? HIV negative. If the patient is HIV positive, yeah, you're going to get this. But this patient is HIV negative. Complete an incident report. Yes, you don't need to squeeze to get blood. Let the blood flow normally. Follow facility protocol. And since the patient is HIV negative, you can still screen them for any other organisms, hepatitis B, C. So we're going to do this one. Pay attention to that. That's the protocol. Okay, and this is the explanation. These are NCLEX Q bank questions. If you need that, you have to join our on demand. Subscribe to that, and you get more access to these questions. Over 5,000 questions I do all the time. And this educating a new mother about newborn sleep safety. What do you think? Which statement indicate correct understanding? As you can see, all the questions I never use the word safety because that's what the NCLEX will use. Because most maternity, newborn, some of them may be home, right? Health promotion. But then under that, there's a safety question. This is a safety question. What is the safety question? I'm trying to bring your mind so that you can identify it, so that you can answer it in the safety way. What is the safety question here? Prevention of sudden infant syndrome. Sleep, right? When you talk about baby sleep, think about sudden infant sleep syndrome. Therefore, what? Place the baby on the back to sleep. Use a soft mattress. Place pillow in the crib. Keep soft toy in the crib to prevent suffocation. Allow side sleeping. That means on their side. Pick your answer. Let me know. But test taking strategy, common sense, you can know that if I have to place the baby on their back and then I have to allow the baby to sleep on their side, one of them has to be right. I'm picking this back side. The soft mattress, you get the baby, it can suffocate the baby. Therefore, best one is a hard mattress. Wrong answer. Pillow are tempting, but they should never go into the crib. Soft toys are tempting. They should never go into the crib, even though I say to prevent suffocation. If they give them hard one, yeah, it's wrong. And you should not allow them to sleep on their side. And then suspect placenta abruption in decline. This is a safety question. Think about it carefully. You should be able to recognize what is placenta abruption so that you can see, A, I got to prevent harm to the baby. And therefore, OB questions, there's a bunch of inherent safety questions in it. Which finding should the nurse, what? Support the diagnosis. If you know what the placenta abruption, can you recognize it? Is it painless bleeding? Is it rigid abdomen? Do you see cessation of uterine contraction? Do you see fetal distress or uterine tenderness? What do you think? Think about it. There's abruption. Something, placenta is separate from the wall. There's no way there's going to be what? Baby is going to be okay. Therefore, fetal distress. You're going to bleed if the placenta pull away and you're already having pain. It's going to work painful, not painless. The abdomen is going to be painful and turns rigid abdomen. If it's rigid, the uterus are going to get tenderness. Therefore, that's the way. Don't memorize them. Bring your concept. Question 5, halfway. What is your score so far? I know you get 4 out of 5. 4 out of 4. And it's scary for a client with epidural during labor. This is a safety question. It's the key. Epidural, what is that? Hypotension and numbness of the leg. These two things will cause you to do certain things for the baby, mommy. Hypotension and numbness of the leg. Which action should the nurse take? Monitor the blood pressure, assist with ambulation, keep client flat after insertion, assess bladder status, monitor fetal eye tone. There's a bunch of trappy answers. Don't overlook them and don't pick them because they sound nice. Think about the strategy I've given you, common sense strategy. There's a safety regarding hypotension and the safety about numbness in leg. Which answer choice you pick? Of course, the blood pressure is going to drop. We got to monitor it. There's a temptation. You think assist with ambulation, so you pick it. No, when you have epidural, you don't get out of bed because your leg doesn't work anymore. Therefore, don't pick it. Keeping them a client flat. Pregnant lady should never be flat. Therefore, on their side is the best way. Assess their bladder status because they have urinary retention due to the numbness in the pelvic area. And then you monitor the fetal heart. These are very, very important strategy to answer questions. Did you get that? I hope you do. It's a selected apply. Don't over-select. Don't pick it. If you don't know, if you know only one, pick one and walk away. The next is caring for a client with postpartum hemorrhage. What does that mean? Postpartum hemorrhage, safety. Mommy is going to be in shock and the baby is going to have fetal distress. You see the way I bring the content, the buzzword, I use it, and I'm going to use that information I just said to answer my question. Which intervention are appropriate? Shock, fetal distress. Are you going to massage the fundus? Are you going to give the baby the mommy Pitocin? Are you going to prepare for C-section? Are you going to monitor for virus every 6 hours? Are you going to insert 25 gauge IV? What do you think? Think about it. Common sense strategy. All these answers, I'm trying to let you think common sense way. Don't memorize. If there's hemorrhage and I'm worried about shock, then I need to give the mommy a bunch of fluid. 25 gauge needle is not going to help you. No, if you have to resuscitate somebody, 16 or 18. Wrong answer. If I know that mommy is going to be in shock, vital sign every 6 hours, that's bad. If you are in shock, C-section is not the best thing. We need immediate stabilization. Postpartum hemorrhage does not go to C-section unless you've done everything. That's a bad move. Give them Pitocin, massage them, give them 18 gauge IV, monitor them more frequently, have blood available, transfuse them. They become unstable, take them to surgery. Number 7, and then identify a prolapse umbilical cord, bad problem. What is the problem? Baby is going to become hypoxia. We want to prevent hypoxia. Which action should the nurse take? Select or apply. Place the client in the left lateral position. Apply firm pressure to the presenting part. Administer oxygen. Push the cord back inside and call for help. I said hypoxia. Prevent the baby from having hypoxia. Which is the best strategy? Cord prolapse. Left lateral position, wrong answer. Into chest, therefore don't pick it. Firm pressure on the presenting cord, you're going to cause problem, hypoxia. Give the mommy oxygen. Don't push the cord back on. Here you apply the gentle, you just lift the presenting part gently, and then you call for help. Number 8, and this is assessing administering Pitocin to induce labor. Which finding indicate the need to stop the infusion? Safety. That means you want to prevent toxicity. And what is the toxicity? Overstimulation of the uterus. Which of these signs indicate overstimulation? Questions are designed to give you clue. By your job to take those information, rewrite it on your own. Use that information to look for answers. Don't look at the question they've given you. I read the question. Patients having Pitocin infusion for labor. And when would I stop it? If the Pitocin is causing problem, how would I know? Tachysystole. What is the problem? Overstimulation. Contraction lasting 60 seconds. Fetal heart tone. Heart rate is 90. Contraction every 3 minutes. Resting tone 100. Fetal heart rate decrease as soon as uterine contractions start. What do you think? Stop the video. Pick your answer. Let me know. But if your contraction lasting 60 seconds, that's fine. It should not last more than 90 seconds. Therefore, this is good. Baby heart rate is 90. That's bradycardia. Heart rate is 110 and 140 is normal. Baby should be accelerating, not decelerating. With contraction, that's what we want. We don't want deceleration. Contraction every 3 minutes, you need at least every 2 minutes. That's good. And the resting tone greater than 80, that's a problem. Fetal heart rate decreases as soon as uterine contraction. It means early deceleration. Nothing to worry about it. It's air compression. That's your peace of mind. You can still continue to monitor. And next is caring for a client receiving magnesium sulfate for preeclampsia, which finding require immediate intervention. Same thing. Think about it. Common sense. Magnesium. What is the problem? Toxicity. If there's toxicity, it's going to depress everything down. So you don't want mommy to have depression of everything. Respiratory of 16. What do you think? During output 20, deep 10 reflex plus 2, saturation in 90, decreased level of consciousness. Which one require immediate intervention? This is normal. Respiratory of 16 is normal. During output 20, well, you cannot get rid of the magnesium. That's a problem. Reflex of 2, that's normal. Saturation less than 95 is a problem. And your level of consciousness has decreased. We have neurological symptoms. Bad problem. Last questions. What do you think? I know you get 10 out of 10 after this one. And this is caring for a client 2 hours postpartum following vaginal delivery. Which intervention should the nurse implement to promote safety? She just had a baby. Postpartum, 2 hours. Provide support. She's going to be hypotensive. Her legs will never be good. She may need a Foley catheter. All of this. So assist the client when ambulating for the first time. Encourage the client to ambulate independently. Assess for dizziness before ambulating. Keep the bed in the lowest position. Place call light within reach. All this means is post-op patient, how do you provide safety? Of course. Call bell within reach so that they don't fall. Bed in the lowest position. If they're walking, make sure they're not dizzy. These two are contradicting each other. Therefore, one has to be good. Encourage the client to ambulate ambulately and independently, and then you ambulating with them. This is the right answer. 10 questions. Maternity, newborn, safety question, NCLEX practice question, NCLEX review question, NCLEX safety question. What is your score? Put down in the comment. Did this video help you learn something? Just subscribe to Adapt NCLEX or share the video or put a small comment in the comment section so that we can grow this channel. Take care of yourself and thank you for watching. Bye.